Host factors. So far, there has been no conclusive evidence to prove that there are significant differences between males and females in terms of their vulnerability. So far, they have shown to have similar incubation periods, time between symptoms and hospitalization, and time between hospitalization and death. The only significant difference that has been found is that women are less likely to die than men are. It's unclear why this is, though it's suspected that social factors may play a part in that. Age also influences the likelihood of catching Ebola. The likelihood of catching it increases with age, as children are found to be less likely than adults to catch the virus. This table represents the number of recorded cases of Ebola in Guinea, Sierra Leone, and Liberia, which were the three most infected nations. It's sorted out between male patients and female patients. As stated earlier, most of this is the same between males and females, until you get to the bottom where it says case fatality rate. In all cases, males have a higher fatality rate than women do throughout the three nations. The following graphs represent the incidences of Ebola by age group among the three most infected nations. The top graph represents all confirmed and probable cases, graph B is all confirmed cases, and graph C is all cases excluding that of health workers. In all of these cases, the incidences rise as age goes up. Environmental variables. Environmental variables can affect a person's vulnerability to Ebola. For geography, some communities where the virus was strongest were built in areas where bats were common. Bats, of course, are known to carry the disease. Living in these communities increased exposure to these bats as well as to the Ebola virus. The urbanization of communities. Underdeveloped communities are those that are most susceptible to the disease. They receive few of the country's monetary resources and have poor health resources and health education. As a result of poor resources and education, many citizens turn to faith healers rather than to professionals when it comes to medical help. Politics. Political corruption is common in the area. Political corruption leads to large health inequalities, which creates more underdeveloped regions. As stated earlier, these regions have poor monetary and health resources. Occupation. Health workers are most likely to catch Ebola. They have higher exposure rates than the general public. Because of the poor health education and resources in this area, it also means that the health workers are not well equipped or well trained enough to deal with the virus. If you look at the exposure rates at the peak of the Ebola outbreak, health workers take up a significant portion of those who have caught the virus. Temporal variation. It is suspected that seasonal trends have something to do with the temporal variation of the Ebola virus. It is suggested that incidences increase when areas have higher humidity and lower temperature. This is because the number of bats carrying the disease increase in this season due to their fighting and mating practices. Typically, this occurs between the rainy and dry seasons, when the seasons are changing. This corresponds with what we know of the Ebola outbreak in West Africa. This region's rainy season is typically between May and October, and the dry season between December and February. The Ebola virus peaked around October and November, right when the seasons were changing, and slowly declined after that.